Welcome to North of the Broad, everyone. I'm your host, Robyn Zimmerman. We bring you our show each week from the Pat Conroy Literary Center in downtown Beaufort. And our first two guests are from Tidal Creek Physical Therapy. It's a new business that just opened on Ladies Island on May the 3rd. We have Trey Gore, who is the manager, and we have Faith Wade, who is a patient care coordinator. So welcome, guys.
Thank you for having us.
So I hear business is going really well. So talk a little bit about what you offer, Trey. What kind of physical therapies that you offer for folks?
Mm-hmm. So I'm the doctor of physical therapy at Tidal Creek. We offer one-on-one patient care. We're very big on hands-on manual therapy. We treat common, uncommon injuries. We do vestibular balance rehab.
Okay.
We work with stroke, neurological. We also offer some other services that are pretty popular, including the cupping, one of the newer techniques, including dry needling. And we do, it's mostly hands-on. We're really big on the hands-on. And then, of course, the exercise. About 3/4 of the session will be spent doing exercise, stretching, manual. Yes, ma'am. Mm-hmm. And then the last little bit, we kind of focus on the feel-good stuff.
So what are some of the most common kinds of reasons why somebody would come to or need physical therapy?
Mm-hmm. So usually a big referral source, what we usually see is back pain, cervical pain, spinal pain, but we also have, the other joints, hips, knees, foot and ankle. We do joint replacements, of course, neurological, strokes, stuff like that.
Right. And you work with folks after surgeries to get them back.
Sometimes we work with them before surgery to kind of get them to a good level so that whenever they have surgery, their outcomes are a little better after they finish.
Perfect. Now, Faith, you're a patient care coordinator, which means you kind of navigate a patient through the insurance process and that piece of the business side of it. So can you just show up and then have your insurance be filed, or do you have to be referred?
We do have patients that come on their own as direct access. They can either call in or just show up, and if we have time, we'll go ahead and see them on the spot. If we don't have appointments available for that day, we can usually get them in within 48 hours. And we make sure that we either file their insurance for them. If they're self-pay clients, then we do have that option as well. But we do accept all insurances. So you may have a small copay, but we do accept those with all insurances in our area.
Now, are you an independent business, or are you associated with another larger PT?
We're individually owned. So it's no corporate. We don't have anybody above us.
So why is that important for the customer, the patient? Why do you think that's important to be independent?
I think it gives that more personal touch. Sometimes you have a lot of rules and regulations as far as what the corporation you work for, how they want you to operate. We've seen a lot with the more corporate therapy clinics where people call it a mill. You've got one therapist for 2, 3, 4 patients, and you don't get that individual touch.
So are you, because I've been through that experience where I have a PT and they're working with me and then 2 or 3 other people on the floor. Are you saying that you all do that one-on-one and you're not with other?
Exactly.
Absolutely. We really pride ourselves on making sure that our patients get the individual attention that they need, and we make sure that we do everything that we can so they have the best result from their physical therapy. We're even able to see patients not have to have surgery after they've come to us, and we're able to help rehab them.
Isn't that great? That's a big goal, wouldn't it be?
It
to
is.
Not have to have surgery.
Very rewarding for us, too.
Yes. So let's talk, you're on Ladies Island, hours, your location, all of that.
So we're at 95 Sea Island Parkway. We're Suite 103, right where Upper Crust and Fuji are.
Okay.
We're open from 8 to 7. So we kind of branched out to that so that the people who are working can come after work.
Nice. Yes.
We want to accommodate everybody, just like we take every insurance too. And then we're also open Saturday, a half day from 8 to 12.
Okay.
So we're very accommodating for our patients.
And staff, so are you small and then you hope to grow, or what is the vision there?
It's small and we'll kind of down the road possibly branch out. But right now it's just one PT, myself.
Okay.
We have 2 or 3 PTAs, physical therapy assistants. We've got Faith, and it's a very small operation.
We're like a family, and our patients are the same way. We all we're excited to see each other every day, and we all look forward to seeing each other.
Sounds
I
wonderful.
mean, you could call it a mom and pop if you wanted to call it that.
Well, you said business is going well, so obviously the word is on the street.
Mm-hmm.
It is.
And that's what we kind of pride ourselves in, is that word of mouth.
Yes,
You know, we
absolutely.
we do a good job. You go and tell your friends,
Absolutely.
your doctors, and it comes back.
And again, the name is Tidal Creek Physical Therapy on Ladies Island. Thank you so much, Trey.
Thanks for having us.
And Faith, appreciate you being with us in North of the Broad.
Thank you for having us.
And we'll be right back.